National Health Insurance Policy, Part 2, going down to the 1950s to 1959. In 1951, the Joint Commission on the Accreditation of Hospitals, JCAH, formed to improve the quality of hospital care, still needed. In 1952, the Federal Security Agency proposed the enactment of health insurance for those receiving Social Security benefits. In 1956, a military program was enacted that provided government health insurance for dependents of those serving in the armed forces. The Foreign Bill was introduced in the House in 1956 to provide health insurance for Social Security beneficiaries. It was reintroduced in 1959. In 1957, the AMA continued to oppose the National Health Insurance, and National Health Interview Survey was first conducted. It has been continuously conducted ever since. In 1960-1969, as an employer-based health coverage grew and were found to be excluded from an employer's taxable income, private plans began to set premiums based off their new experience with various health costs. Those individuals who were retired or were living with a disability found it harder to get affordable coverage. In 1960, the Federal Employees Health Benefit Plan was begun to provide health insurance to federal workers. The Kerr-Mills Act was passed, we will go into that later, which uses federal funds to support state programs providing medical care to the poor and elderly, a precursor to Medicaid. What is Medicaid? In 1961, the White House Conference on Aging was held, in which the task force recommended health insurance for the elderly under the Social Security. The King-Anderson Bill, we'll go into that later, introduced create a government health insurance program for the aged. Drew support for the organized labor and intense opposition from the AMA and commercial health insurance carriers. President Kennedy addressed the nation in 1962 on top of Medicare, and President Johnson would continue to advocate for Medicare when he succeeded President Kennedy. In 1965, a year after passing the Civil Rights Act, the Medicare and Medicaid coverages were incorporated to the Security and signed into President Johnson. The bill had massive public approval. The support for the hospital insurance industries and no government cost controls physician or fee schedules within it. Also in 1965, the Office of Economic Opportunity established neighborhoods health centers, precursor to FQHCs, to provide health and Social Security to the poor and medically underserved communities.